Disclosures nil relevant. Primary angle closure glaucoma is a chronic and largely asymptomatic disease unless the presentation is late. However, this may occasionally be intercepted by a symptomatic acute presentation in the presence of glaucomatous disc changes. Patients complain of pain and present with shallow AC and very high intraocular pressure, and there may be variable degree of ciliary congestion, corneal edema, glaucom flecken, and sphincter ischemia. All eyes in this series underwent laser peripheral iridotomy first. When this failed to resolve the issue, then the surgical route was taken. Mannitol injection was administered preoperatively wherever indicated. After phaco surgery and IOL placement in the bag, a 20-gauge endoscope was introduced into the AC to visualize the angle. Here in this case, it appeared to be almost completely closed even after phaco. Following this, the endoscope was introduced into the sulcus and the ciliary processes were visualized. Delivery of the laser was under direct vision and it was aimed at the tail of the ciliary process, the end point of whitening and shrinkage of the ciliary body posteriorly away from the iris. Approximately 28 to 32 processes were treated, covering 180 to 210 degrees. Laser energy was determined by shrinkage of the ciliary process and varied between 250 to 500 milliwatts, duration being constant at 2 seconds. POPs were strictly avoided, and when encountered, it warranted a reduction in the power. At the end of the procedure, the endoscope is reintroduced into the AC, and in this case, the angle seems to have opened up, albeit with heavy pigmentation. Viscoelastic is then washed thoroughly. In another example, angle is closed post-phaco and only a clump of pigment is visible anterior to Schwalb's line, but it opens up after endocycloplasty. This is a case where intraoperative gonioscopy was done. Angle was closed prior to cataract surgery and after it. However, post-endocycloplasty, it opened up inferiorly, barring 1 clock hour of peripheral anterior synecdoche. In this series, 6 eyes of 5 patients were included. All were females, mean age 52, mean axial length 22.5, mean AC depth 2.3, mean lens thickness 5.0. Mean VFI was 31.2%, mean peripheral anterior synecdoche on gonioscopy was 3.4 quads. All preoperative baseline parameters of visual acuity, intraocular pressure, anti-glaucoma medication were vastly improved post-operatively, and none of the eyes had any serious sight-threatening complications. To conclude, in this series, Phaco-endocycloplasty led to satisfactory resolution of acute on chronic primary angle closure glaucoma.